Now, again, going back to your experience, what have you brought from your experience into your franchise play in your operations playbook?
Yeah, there's a lot that I could bring in, and working in different programs where there's a lot of different provider types touching the patient. Still thinking about how we can do a light diet version of that with some of our clients, right? And but I think from what I brought to this situation is I know how to collaborate with the different provider types that do touch our patients, like the home health agencies, like who provide the physical therapy, the occupational therapy, the speech therapy, and provide that RN oversight. And an example is, can my caregivers learn some of the therapies that you're performing with the client when you're here 2 times a week, so that we can do it 5 days a week for our client. We can help them. Although we're not licensed therapists, we can learn and we can monitor in a safe way of how this patient can continue to do their exercise. I've also explained to my clients that my experience is that your first 30 days after a hospital discharge or post-surgical is going to determine your recovery plateau for the next year. And that first year will determine your recovery plateau for the rest of your life. So it all starts with those first 30 days and making sure that they're motivated to do what it takes in the home, whether it's therapy, getting them to that independence with being able to shower themselves, because we're not intended to be a permanent solution for all of our clients. Some of our clients are on different journeys. Some of our clients are not only on a they just want to be comfortable and have a better quality of life, but some of them are trying to recover from a difficult procedure or a surgery, and they can meet their plateau and they can be independent. So some things that I brought is encouraging and motivating our clients, coaching my caregivers through how to have those conversations to ensure they're doing the right things in those first 30 days, and how to partner with the different types of providers that would be interacting with the client, and making sure we're monitoring changes in conditions as well. That's another aspect that I bring from from my hospital admin days is, when we're in home, are we monitoring for their vitals? Are we monitoring for their outtake and their intake and other conditions? If we're noticing something, speak up. Let's tell the family. Let's also tell the home health agency. Let's tell the hospice agency if one that's involved. And just making sure we're adding value and we're being able to provide a proactive assistance, as opposed to, oh, we have an urgent situation on our hands, we have to call and get back into the hospital. So those are some of the aspects that I bring from my hospital admin days that I try to introduce to our caregivers.